Heart disease is one of the most common and significant health challenges faced by people worldwide. It is the leading cause of death globally, affecting millions of individuals regardless of age, gender, or background. While heart disease can seem like a distant threat for many, it is a reality that anyone can face. The good news is that heart disease is largely preventable, and advancements in treatment have made it possible for many people to lead long and healthy lives despite a diagnosis. In this story, we will explore heart disease, its risk factors, prevention methods, and the various treatments available today. From lifestyle changes to cutting-edge medical interventions, the battle against heart disease is one that is being fought on multiple fronts, offering hope for millions around the world. Heart disease, also known as cardiovascular disease, CVD, refers to a range of conditions that affect the heart and blood vessels. It includes conditions like coronary artery disease, heart failure, arrhythmias, irregular heartbeats, and heart attacks. The underlying cause of many types of heart disease is atherosclerosis, a condition in which the blood vessels become narrowed or blocked due to a buildup of fatty deposits, cholesterol, and other substances. Coronary artery disease, CAD, the most common form of heart disease, occurs when the arteries that supply blood to the heart become blocked or narrowed. This can lead to chest pain, shortness of breath, or even a heart attack. A heart attack occurs when the blood flow to a part of the heart is completely blocked, damaging the heart muscle. The symptoms of heart disease are not always obvious. In many cases, individuals may experience no symptoms until the disease has reached an advanced stage. This makes heart disease particularly dangerous, as it can progress silently for years before a major event like a heart attack or stroke occurs. Heart disease doesn't happen overnight. It develops over time as a result of various factors. Some of these factors are within your control, while others, such as age or genetics, are not. Understanding these risk factors is crucial for taking proactive steps to reduce your chances of developing heart disease. Unhealthy diet. A poor diet that is high in saturated fats, trans fats, and cholesterol can increase your risk of heart disease. Foods like red meat, fried foods, and processed snacks contribute to plaque buildup in the arteries. Lack of physical activity. A sedentary lifestyle is one of the leading contributors to heart disease. Regular physical activity helps keep the heart and blood vessels healthy by improving circulation, reducing blood pressure, and maintaining a healthy weight. Obesity. Being overweight or obese is directly linked to an increased risk of heart disease. Excess weight puts additional strain on the heart and increases the risk of developing high blood pressure, diabetes, and high cholesterol, all of which are risk factors for heart disease. Smoking. Smoking is one of the most harmful habits for the heart. It damages the blood vessels, raises blood pressure, and decreases the oxygen in the blood, making it more difficult for the heart to function properly. High blood pressure. Hypertension, high blood pressure, is a leading cause of heart disease. Over time, high blood pressure can damage the arteries and lead to heart failure or heart attacks. Regular monitoring of blood pressure is important for early detection and prevention. High cholesterol. High levels of LDL, low-density lipoprotein, cholesterol, often referred to as bad cholesterol, can lead to plaque buildup in the arteries, increasing the risk of heart disease. On the other hand, HDL, high-density lipoprotein cholesterol, is known as good cholesterol and helps remove excess cholesterol from the bloodstream. Diabetes. Individuals with diabetes are at higher risk for heart disease. High blood sugar levels can damage blood vessels and lead to cardiovascular problems over time. Family history and age. A family history of heart disease increases your risk, particularly if a parent or sibling developed heart disease at an early age. As people age, their risk of heart disease also increases as the heart and blood vessels naturally undergo changes. Stress. Chronic stress can contribute to heart disease. Stress may lead to poor lifestyle choices, such as overeating or smoking, and can increase blood pressure, putting additional strain on the heart. Excessive alcohol consumption. Drinking alcohol in excess can increase blood pressure, contribute to weight gain, and increase the risk of heart disease. Prevention. How to lower your risk of heart disease. While you cannot change factors like your age or family history, there is much you can do to reduce your risk of heart disease. Prevention is key to living a long and healthy life. The following lifestyle changes can help lower your risk. Adopt a heart-healthy diet. A balanced diet that is rich in fruits, vegetables, whole grains, lean proteins, and healthy fats is essential for heart health. Limit your intake of processed foods, sugary drinks, and excessive salt. Focus on eating foods that are high in fiber, such as oats, beans, and leafy greens, to help lower cholesterol levels. Exercise regularly. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Activities like walking, jogging, swimming, and cycling can help maintain a healthy weight, improve cardiovascular health, and reduce stress levels. Maintain a healthy weight. Achieving and maintaining a healthy weight can reduce the strain on your heart. If you are overweight, losing even a small amount of weight can help lower your risk of heart disease, diabetes, and high blood pressure. Quit smoking. If you smoke, quitting is one of the best things you can do for your heart health. Within just a few months of quitting, circulation improves, blood pressure decreases, and the risk of heart disease drops significantly. Manage blood pressure. Regularly check your blood pressure and take steps to keep it within a healthy range. If your blood pressure is high, your doctor may recommend medications, lifestyle changes, or both. Control cholesterol levels. Eating a healthy diet, exercising, and taking prescribed medications can help lower LDL cholesterol and raise HDL cholesterol, improving overall heart health. Limit alcohol consumption. If you drink alcohol, do so in moderation. This means no more than 1 drink per day for women and 2 drinks per day for men. Reduce stress. Managing stress is vital for heart health. Practice relaxation techniques such as yoga, meditation, or deep breathing to help reduce stress and improve your emotional well-being. Get enough sleep. Adequate sleep is important for overall health, including heart health. Aim for 7 to 9 hours of sleep per night to give your heart and body time to recover. Treatment options for heart disease. Despite best efforts at prevention, some individuals may still develop heart disease. When heart disease is diagnosed, a combination of lifestyle changes, medications, and procedures can help manage the condition and prevent complications. Statins. These drugs are used to lower cholesterol levels and prevent plaque buildup in the arteries. Beta blockers. These help lower blood pressure, reduce heart rate, and prevent arrhythmias. ACE inhibitors. These medications help lower blood pressure and reduce the workload on the heart. Blood thinners, used to prevent blood clots which can lead to heart attacks and strokes. Diuretics. These help remove excess fluid from the body, which is beneficial for individuals with heart failure. Angioplasty and stent placement. If coronary arteries are blocked, a procedure called angioplasty can be used to open up the blocked artery and improve blood flow. During this procedure, a balloon is inflated to widen the artery, and a stent, a small mesh tube, is placed to keep the artery open. Bypass surgery. In more severe cases of coronary artery disease, coronary artery bypass grafting, CABG, may be necessary. This surgery involves taking a healthy blood vessel from another part of the body and using it to bypass the blocked or narrowed coronary artery, restoring blood flow to the heart. Heart valve repair or replacement. If heart valves are damaged or diseased, a valve replacement or repair may be required to restore normal heart function. Pacemakers and defibrillators. In cases of arrhythmias, a pacemaker may be implanted to regulate the heart's electrical signals. For patients at risk of life-threatening arrhythmias, a defibrillator may be used to restore normal heart rhythm. Heart transplant. In the most extreme cases where other treatments are ineffective, a heart transplant may be necessary. This involves replacing a damaged or diseased heart with a healthy donor heart. Living with heart disease, the role of support and lifestyle. For those living with heart disease, managing the condition is an ongoing process. Adopting a heart-healthy lifestyle is essential, even after treatment. Regular checkups with a healthcare provider, medication adherence, and making continued efforts to stay active and maintain a healthy diet can all help manage the disease and improve quality of life. Support from family, friends, and healthcare providers plays a vital role in the journey of heart disease. Many patients benefit from joining support groups where they can share their experiences and gain insights from others facing similar challenges. Emotional and mental health are just as important as physical health in managing chronic conditions like heart disease. Heart disease remains a major global health issue, but it is not a death sentence. With prevention, early detection, and advances in treatment, people living with heart disease can lead healthy and fulfilling lives. By understanding the risk factors, making lifestyle changes, and seeking appropriate treatment, individuals can significantly reduce their risk and improve their chances of living a long and healthy life. As medical science continues to progress, the future of heart disease treatment looks promising. New drugs, surgical techniques, and technologies are making it easier to manage the disease and reduce complications. The ongoing research in cardiology holds the potential to offer even more effective treatments, and one day, we may even see a world where heart disease is no longer a leading cause of death. Until then, prevention and early intervention remain the best tools in the fight against heart disease. By taking care of your heart today, you are investing in a healthier tomorrow.